Hi everybody, this is Upal from Sarisa Dentistry in Beaconsfield. Welcome back. First of all, can I just say thank you to all the messages and comments I've been getting about these videos. I was very unsure about doing them, but I'm feeling very motivated having read the feedback that I'm getting, that whilst we are in lockdown, and particularly for me personally, as a dentist, I'm feeling slightly frustrated with the state of affairs, and we're limited as to how we can manage our patients, but I'm glad that I can do something more positive with it and put some information out there that you guys are finding quite useful. So thank you very much. I did a video earlier on plaque and importance of toothbrushing to remove that plaque. I am going to follow up with a video on a demo of toothbrushing itself, but at the moment I'm negotiating with a 10-year-old who is having pretty full-on virtual learning, so trying to find a window because I need him as a model, because the only other option is that I've got a 13-year-old who is a 13-year-old, and willingness to participate is sort of slightly fragile, so I'm not holding out on that one. But on the plus side, he thinks I'm very cool because I'm posting IGTV videos, so win-win. So let's go back to dentistry. I did a video about toothbrushing, and I thought I could do a short clip and just run through how you make the decision as to which toothbrush you're going to buy, because I think one of the most common questions we get asked at the practice is, oh Paul, which toothbrush should I go? How do I choose the right one for me? All right, so whistle stop talk. Manual toothbrushes, orange brand, they're kind of going out of fashion, I suppose is the word. We still have a loyal cohort of patients who do use them and get on very well with them. And if you are someone who really wants to stick with a manual toothbrush, then it's very simply put, I would say choose one that's ergonomic, so something that you can grip well and use effectively. You want something that doesn't have too big a head, okay? Because a lot of these toothbrushing marketing is centered around big heads, but anything too big is difficult to maneuver around the mouth. So you want something with a medium-sized head, medium tufted toothbrush bristles, and really as many bristles as possible so that you can get an effective clean. I'm not so keen on them, let's put it that way, because I think that with the electric toothbrushes that are now on the market, you can get a far more effective clean with a lot less work. And the second point is that most patients who like manual toothbrushes like them, but they scrub with them, and that scrubbing action, in order for them to achieve that they've got the clean that they want, is actually quite damaging. And we know that you'll see damage to tooth structure and problems of gum recession. So if you are someone who struggles with gum recession, I would certainly say put your manual toothbrush to the side and to start thinking about shifting over to electric toothbrushes. Now, the biggest challenge is actually that learning curve where you move from a manual to an electric toothbrush. So patients in our practice, if they do shift over, we will always say, bring your toothbrush in, see one of our hygienists, and they will actually run through and give them a demo as to how they work and how to use them, how to sort of shift over from the manual to the electric ethos. These are electric toothbrushes, so they're rechargeable, so they have docks to recharge them, all right? Different to battery-operated toothbrushes. Don't like battery-operated toothbrushes, put them in the bin. They are cheap and cheerful, readily available, but really the problem with them is as the battery life drops, which happens very quickly, so does their efficacy, and really they're not doing an effective job. And by the time you at home notice that they're not working well, it's really been a pretty fruitless exercise with them. So don't bother with battery operated toothbrushes, stick to something rechargeable. I don't have any affiliation to these brands, but these are the two most common toothbrushes used by our patients at the practice, and the ones that I think are sort of leading market at the moment. All right, they fall into two main groups really because of the way they work. So let's talk about this one first. This is by Philips. It's called a sonic air. It's so cool because it works by a sonic action. I'm going to bring this really close so you can see it. All right, so it vibrates really rapidly, and it is that sonic action that dislodges plaque, so you know, the bacteria and the food bits that are in that, and flushes, it helps flush it all away. And the idea being that where it sonically vibrates, it can really get into all those nooks and crannies for you and remove everything quite effectively. I have, well, I should say we have a huge cohort of patients who are very loyal users of the Sonicare toothbrush, but those who don't get on it, and that's me included, don't like the sensation that it creates. So if you like it and you use it, great. If you are thinking about switching to electric toothbrush, just bear that in mind. Sometimes worth popping into someone like John Lewis, for example, and just playing around with them and see how they feel, because they work very differently. The other brand that we recommend is Oral-B, and I, personal choice, I'm an Oral-B user. I just like the way they work and I like the way they feel, but you know, they both are very effective at achieving the same job. Now, Oral-B, getting slightly technical, use what we call an oscillation rotation concept to work. So coming closer again, okay, and that means that that head is constantly rotating, and at the same time it's oscillating to create the action they call shearing, to remove that plaque and take it away from the surface of our teeth. I think it's a great toothbrush. The problem with Oral-B is I think they make their marketing slightly confusing for you, the public at home. And I try and simplify that for our patients and say that if you're going to buy an Oral-B electric toothbrush, then look at their numbers. They call them Oral-B 600, Oral-B 650, Oral-B 1000, 2000, 3000, 9000. And now they've moved on to Oral-B Pro 2, so the Pro would be the equivalent to a 2000. You want to buy anything above Oral-B Pro 2 or Oral-B 2000. And I say that because within that range, you'll get a toothbrush that has an effective oscillation rotation mechanism that we want. It has a couple of settings, so you can generally shift from a normal setting to a soft setting or a gentle setting. Has preset timers on it, so it will vibrate at you every 30 seconds and then do another vibration when you reach your 2 minutes to help guide you through that 2-minute brushing process. And most importantly, it has a pressure sensor on it, so if you press very hard, you've got the white line there, it will go red, all right, telling that you're pressing too hard. They of course vary in price range, as does Philips Sonicare. They are a little bit more expensive, although they have introduced a slightly cheaper range. Oral-B, again, vary in range. The top end of their toothbrush is the Oral-B 9000, which is this one, and it has an app linked to it and sort of helps you see and log your toothbrushing habits, but I don't know how many people actually do that. And what the higher end one has, which is the Oral-B 9000, as does the Sonicare, is travel cases, which for us is a really useful component, because a lot of our patients do a lot of travelling, and so they have the ability to take that travel case away with them and be able to charge up their bases using a USB port and the connection that goes into their travel case. Let's talk about heads. So both have heads that you can swap out, all right? And that one does that. Sonicare heads are a little bit more expensive to change than Oral-B heads, but both advocate that you should change them every 3 months. We say to patients you should be changing them every 2 to 3 months. If you are finding that you're needing to replace them sooner than that 2 to 3 month period, it's probably because actually you're not using your toothbrush correctly and probably zealous with it. And at that point, usually we would say to you, come in, or I say to you, once lockdown's over, go and see your hygienist, and they can just guide you through where you're perhaps going wrong and modify that technique for you so that we can get you back on the right path. Oral-B toothbrushes, again, very confusing. They do a cross action, which is this one. They do a slim head. They do a precision clean. They do a whitening one. I don't really mind, but I generally say to patients, use the precision clean or the cross action. My husband, who is also the dentist at practice, isn't keen on the cross action and prefers the precision clean, but don't get too bogged down with that. I think they all work pretty effectively. What else is there to say? The other thing I like about Oral-B, let's just talk about kids' toothbrushes while we're on the subject, actually. Oral-B do a kids one which has various characters on the base of it, so Marvel and Frozen, and then they've now introduced an intermediate junior range, which are just purple, green, blue basic bases. And they've done that so that you can have the kids one for younger age groups, sort of between 5 to 7, and then the intermediate one is between 6 and 12. The idea being that you can shift them onto the adult toothbrush once they're 12 or 13. They have that range because the rotation oscillation is reduced in those kids' toothbrushes, and I think that's a really important point, because I say to our patients, parents, don't use this on a younger mouth. It's a pretty aggressive sensation, and if anything, you're going to put them off. So if you are keen on looking at electric toothbrushes for the younger members of your family, explore those options. I think maybe it might be a good idea to do a video on that just to show you those, but there is a reason why they have been set up that way, and I would certainly encourage you to look at choosing the right one for the right age group, because they are designed to work in a mouth of that age. I think that's about it. Enjoy your day. Thanks for listening. Bye.